Okay, I think I'm going to start. So I'm Professor Wanda Markotter. I'm the Interim Director here at Future Africa, and I'm going to play the role of Program Director today, but also introducing all the speakers that you will hear. So dear esteemed guests, including members of the diplomatic corps, embassies, industry, leadership and researchers from other universities and science institutes, including colleagues joining us from outside South Africa. Maybe just the hands who's from outside South Africa. I think Zacharias, is he here? Tafadzwa? Yeah, but Zach, is he here from Gambian? Oh, is it? Okay, I thought he also joined us from the Gambian, but all the other people that's joining us from outside South Africa, students, there's a lot of postdoctoral fellows that I see in the audience, which is great. The director of the Lancet Countdown, Prof Tafadzwanashe Mabhaudhi, who will also, you will hear from him later on what is this all about. Members of the Global Lancet Countdown, members of the University Executive, specifically here in front, our VC, Professor Petersen and Prof Maharaj, our DVC. And then also a really big welcome to our online audience that's also joining us from all over the world today. So it's really a great pleasure as the Interim Director of Future Africa to welcome you to this really significant and celebratory event where we're launching the African Regional Center of the Lancet Countdown on tracking progress in health and climate change. And we can now proudly say that we're going to host this at Future Africa at the University of Pretoria, where you're also present today. So just a few comments on Future Africa before I hand over to the rest of the speakers. It is the University of Pretoria Pan-African platform, really for collaborative transdisciplinary research that works really across the sciences and also with society to address some of our complex challenges, and specifically also what we're talking about today, climate and health. So what do we mean really with transformative research? I mean, we use these words and I don't think we always unpack what it means, but it's really integrative. So it's not just about one discipline, it's not just about one stakeholder, it's all of these things that we integrate to really generate knowledge, but also how we're going to apply it to make a difference and have an impact. It's engaged. That's why you're all here. We're not sitting in our labs and in our offices and just doing this. It's really an engagement when we talk about transformative research. It's holistic. There's lots of words that you can use for that. One Health is one of the words that we use to describe holistic approaches. It has to be digitally enabled if we talk about transformative research, and we have to be future literate. So it's really important that we think about all these things if we talk about transformative research. So just also to say that we talk about the research, we talk about transformative research, but you're also in this wonderful convening space, which we really have the privilege of having as part of Future Africa. So Future Africa is not just about this space, it's actually about what I just told you about transformative research. But the space enables us to have these engaging conversations and invite different stakeholders to be part of these conversations and these outputs. So in terms of Future Africa's leadership, we have researchers and we have chairs that really leads transformative research domain. Some of you may be familiar with the previous domain in sustainable food systems, and this is really at the food, water, climate nexus. We can't just look at food in isolation anymore, and I think Tafadzwa will probably also say something about this because this also links well to the Lancet Countdown. We have One Health, we have sustainable transformations in Africa, Africa's science and technology futures, and global equity in Africa. And this is just the domains, but there's lots of cross-cutting things also happening. You know, leadership development, developing PhD students, developing postdocs, which is really essential if we want to make a difference, is how we train the young generation and how we build capacity. So we work with our partners across the continent to set African agendas, build capacity, strengthen networks based on expertise, co-design impactful research. I think co-design for me as director is a really important word. It's not just about us coming up with ideas. Co-design, have to have conversations, be engaging to understand what the problems is. And we also host very important cross-cutting initiatives. One of them that you will also hear about is the United Nations Hub on Resilient Environment, Agriculture, Climate and Health for Africa. In short, Reach Africa, which is something that we hosted last year, where we're really bringing all of these conversations also into the United Nations policy space. And this is a very important collaboration with INWE in Canada also, that Tafadzwa is also leading at Future Africa. So as the climate crisis intensifies, Africa is really standing at crossroads. We're feeling it. I mean, I think we're feeling it even on a personal level, you know, how the weather changes every day and how this influences us. It's not just something that's far away. So we really need to establish, and this is the reason why we established the Lancet Countdown African Regional Center and why it's such a major milestone, because it's grounded in the region. I think that is really important. We need to have these initiatives on the African continent. It's strongly coordinated with African leadership. It's Africans leading it. That is the people that you will hear from today in climate and health research. And it's really, I think, embedded in what we will call the African realities, if we start talking about climate and health in this space. So as the director of Future Africa, I'm really proud that the Future Africa at University of Pretoria can host this, but I'm even more proud that it's on the African continent and that we're sitting here at the south point of Africa and we can launch this today. It's not somewhere on another continent. So this launch really marks an important step towards ensuring that African researchers and African knowledge are visible. That is what we have to do with these platforms. We're really visible, but we're also influential in global efforts. Our voices need to be heard. It has to be grounded in scientific excellence and knowledge so that we really play a leadership role on these global platforms, and that we can understand the links between climate and health going forward. So thank you for everybody being here. I'm now starting with thank yous at the end. Prof Sunil will thank you at the beginning. Prof Sunil will thank you at the end. And I look forward to really exciting collaborations that's going to grow from this and transformative research that will emerge from this center. So I'm going to end my introductions, my welcoming there. And then I've got the real privilege to introduce our next speaker, which is here in person, which is our Vice Chancellor of the University, Professor Francis Petersen. He's really a visionary leader in the South African higher education sector, and we can gladly say he's a visionary leader at our university, and he's anchored in University of Pretoria now and not at some other university, as the Principal and Vice Chancellor of University of Pretoria. He's previously held esteemed positions at other universities, Free State, also at the University of Cape Town. He holds a PhD in engineering from Stellenbosch, and his international speaking engagements include prominent conferences worldwide, contributing to the global discourse on higher education and research. And I think a really important position that is currently also the chairperson of the Board of Directors of the University of South Africa. So, Prof Petersen, we're looking forward to your remarks. Thank you.
Thank you. Thank you very much, Professor Markotter, as the Interim Director of Future Africa. And on all of the remarks and the welcome that you already have given, I probably should just say all protocol observed. But I would rather like to also, there's a couple of individuals and group of people that I would like to say welcome, those that are in the room and those that perhaps might not be in the room. But I would like to first welcome our distinguished representatives of the Lancet Countdown, members of the Lancet Countdown board, and also their global partners, representatives from the World Health Organization Africa Office, Africa Centers for Diseases Control. As Wanda already has indicated, we also have our Vice Principal for Research and Internationalization and Innovation, Professor Sunil Maharaj. I also would like to welcome, although she probably already known to you, Professor Wanda Markotter, as the Interim Director of Future Africa, and the fact that we could use this particular venue. Wanda has indicated it's a venue which we're very proud of. It's a venue that played a fantastic role as a convening space of bringing people from across different constituencies, sometimes across different geographies together, and talk about particular issues. And where we have diverse viewpoints is to get a better understanding and appreciation where those viewpoints come from. So the convening ability of Future Africa in the context of what Wanda has indicated, there is also serious research and knowledge generation discussions that happen, but the fact that it can play that magical role of convening is for us very important. Then Professor Tafadzwanashe Mabhaudhi, the Director of the Lancet Countdown African Centre, he will give the keynote address for us a little bit later. And then Dr. Liz Marie Besson, who is the Regional Centre Program Manager. And then obviously to all of you that I haven't mentioned as part of this group of individuals, our esteemed colleagues, partners, policymakers, very importantly students, and then honoured guests that are here this afternoon. And it's really a warm welcome from the University of Pretoria for us to be able to have this official launch of the Lancet Countdown Regional Centre hosted here at the Future Africa campus, but at the University of Pretoria. Now, it is both a privilege and a profound responsibility to host the centre. I think it's an affirmation of a shared strategic continental commitment to critical research. But very importantly, it's not only the research, is the evidence that goes with it. And I'm pretty sure that Professor Mabhaudhi will talk a little bit later in his keynote address of the importance of the evidence part. And then the accountability and the justice components that goes with it, to really safeguard the health of the present and the future generations in a rapidly changing climate environment. The increasingly obvious reality is that climate change is not only an environmental issue. It's a health issue, it's an economic issue, it's very much important for our part of the continent that it is also a development issue. It's indeed a justice issue. And then very importantly, and this is where the convening part also comes in, it's an intersectional issue. So placing health at the center of our climate change response is more urgent now as we need to protect the lives and the livelihoods, especially for marginalized communities across Africa. The Lancet Countdown is globally recognized as one of the most authoritative scientific collaborations on the intersections between environmental change, health systems, and economic well-being. It tracks the health impacts of climate change at centers across the globe and plays a critical role in ensuring that science inform policy and action at every level. And therefore, it's important for us to also, within this audience, have policymakers to be able to pick up what the research and the evidence gives us to be able to shape futuristic policies in this domain. It is a critical development for Africa to be taking its rightful place within this global network through the Africa Regional Centre. Climate change is a tangible and accelerating force throughout Africa, from intensifying droughts and floods to heat stress, food insecurity, air pollution, and the spread of infectious diseases and the rise in non-communicable diseases. The health implications are indeed mounting, putting additional strain on already fragile health systems. The alarming implications of these impacts on children present an existential threat to Africa's future and economic development. And we all know that Africa, which have got the largest percentage of young people, to be able to manage, to develop them in a responsible manner, we need to understand what are these existential threats to exactly that growth. Africa contributes the least to global emissions, yet bears disproportionate burden of the consequences, including increased disease burdens, rising economic losses, and widening inequalities. Yet for years, our science has not been able to inform global climate policy and also the actions that has to go with it. So the launch of the Lancet Countdown Center, or Lancet Countdown Africa Center, will change this narrative and ensure that African scientists and science is elevated into the global discourse. The cost of failing to act on climate and also on health are profound, escalating long-term environmental degradation, irreversible ecosystem loss, increased food security, widening inequality, and mounting economic damage. On the positive side, the benefit of decisive, evidence-based action can indeed be a game changer. And that could be the game changer we require to achieve healthier populations, more resilient economies, strengthened health systems, and sustainable development pathways. It is imperative for Africa to take center stage in the global climate health discourse, contributing, as Wanda has indicated, Africa-led research, data, scholars, and also solutions. And the University of Pretoria is deeply honored that Future Africa has been selected to host the Lancet Countdown Africa Regional Center and ensure that Africa contributes to leadership, to different perspectives, but also intellectual direction to the global debate and action required. We are proud to say with confidence that the University of Pretoria has the institutional strength and demonstrated capacity to convene continental and global networks. Our strong track record in climate and in health research and our transdisciplinary mandate aligns directly with the objectives of the Lancet Countdown, but also the objectives of our new strategy that we launched earlier this year, which is UP's Thrive 2038 strategy. And this strategy extends over a 12-year period. Thrive UP 2038 strongly advances the university or University of Pretoria as a leading research-intensive university that produces knowledge that really impact society positively, with the aim of shaping just, but also sustainable and resilient futures. And if you look at the strategy and what it wants to achieve, and you align the objectives of the Lancet Countdown, then those objectives are very, very closely aligned. Our research, our teaching, and our engagement with society address society's most urgent challenges, and it also nurtures graduates who are skilled, adaptable, compassionate, and committed to addressing the needs of an unequal and a very complex world. And there's a lot of responsibility placed on our graduates leaving our institution to find their rightful position into this complex, uncertain, and challenging world. But also a lot of challenges and responsibility on our academic staff and also support staff that have to nurture those future fit graduates so that they can make the sort of difference that the new world order is expecting. Climate change is fundamentally a health issue, a health systems issue, as I indicated earlier. It influences vector-borne and waterborne illnesses, zoonotic risks, nutrition outcomes, labor productivity, livelihoods, and indeed food security. It links ecosystem degradation with population health issues. It demands that we move beyond silos and draw on the power of transdisciplinary processes and also transdisciplinary platforms such as Future Africa to pursue the interconnectedness of climate systems, of water, of energy, biodiversity, agriculture, urbanization, and also health outcomes. The Lancet Countdown embodies this integrated approach. In addition to tracking temperatures and emissions, it tracks nutrition, labor productivity, air quality, health system preparedness, and economic indicators, translating the evidence to inform policy and practice. University of Pretoria has significantly invested in transdisciplinary platforms precisely because complex challenges required integrated approaches. Future Africa was established as a transdisciplinary Pan-African platform to convene scholars, to convene policymakers, civil society, and also innovators around grand challenges facing the continent and also the world. Through Future Africa and our planetary and One Health research theme, climate scientists, public health experts, behavioral scientists, and community partners work together to co-develop and Wanda talk about the co-creation, co-development as a key part to ensure that we have got adaptive responses. The work not only generates research outputs that is important for universities, but it also supports the behavior change, informs municipal planning, and empowers communities to adopt health protective practices in a warming climate. So hosting the Lancet Countdown Africa Regional Center within this particular space is therefore deeply strategic, but is also aligned. Through the center, Africa-specific climate and health indicators will be developed, and it also will be tracked. Surveillance systems will be strengthened. Early warning systems will be supported. The evidence generated here will illuminate how environmental change translate lived health realities across our continent. Another key Thrive UP 2038 theme is African-led solutions, and the Lancet Center will really indeed augment that. So for too long, data and responses to Africa's climate and health challenges have largely been shaped externally and interpreted through models developed elsewhere. Now, this is neither accurate but nor sustainable. The Africa Regional Center will generate Africa-specific climate and health data. Africa researchers will be the lead authors and the knowledge producers, building and strengthening research capacity across African institutions. It will ensure that continental policy debates are informed by Africa-generated evidence. It will advance global engagement from a position of self-determination and strength. It's like this is Africa, for Africa in action. One of many critical challenges the continent is facing is the shift in climate-sensitive infectious diseases driven by changing rainfall patterns, temperature variability, and ecological disruptions. The Lancet Countdown Africa Regional Center will develop robust indicators to track these shifts, strengthen early warning systems, and inform climate-resilient health interventions across multiple African countries. This will strengthen collaboration and serve as a convening platform linking researchers, policymakers, and also practitioners. It will also closely align with the Sustainable Development Goals, Africa Agenda 2063, and our collective Sustainable Development commitments. In partnership with University of Pretoria and Future Africa, the Centre will deepen international partnerships in the global climate health discourse. In all ways, it is about partnership for impact, partnership where we also take collective responsibility, but also collective action. It is about researchers collaborating without borders. It is about policymakers shaping climate-resilient health systems. But it's also about communities whose lived experience and lived experiences inform our research and indicators, and whose well-being is our ultimate measure of success. One of the most powerful aspects of the Lancet Countdown is its annual reporting mechanism. It holds governments and institutions accountable. It translates complex scientific data into accessible indicators that can inform policy, investment, and public discourse. And I can just think of the fantastic value for researchers and for students that complete higher degrees, masters and PhDs, for this wealth of not only data, but you will have a sense of the value once you have gone through the data, and that evidence inform policy, and you can be able to see that that policy through other mechanisms impact those that are impacted negatively through climate change and other aspects related to the African continent. This aligns strongly with University of Pretoria's commitment to research that matters, research that informs policy, that shapes public debate and improves lives, with universities as active participants in a sustainable and equitable future. As I said at the outset, hosting the Africa Regional Center comes with an enormous responsibility, and I'm just looking at Professor Mabhaudhi. He's not only carrying the responsibility alone, obviously, but it comes with a responsibility. It also comes with urgency, as well as with hope. Africa is the youngest continent. It is a continent of innovation, a continent of resilience, but also a continent with a high level of creativity. Across our cities and rural communities, we see adaptation strategies emerging. We see renewable energy initiatives expanding. We also see community health innovations responding dynamically to environmental change. And we see artificial intelligence and information and communication technologies being used to improve health and education, agriculture, and also economic access. That's all that we see on the continent. But while the Lancet Countdown highlights risk and the actions required, it also illuminates progress, identify practices and adaptation, and highlight all the co-benefits of climate action for health, employment, and also equity. So as Vice-Chancellor, I see this partnership as a defining milestone in our journey towards 2038 and beyond. It collectively reinforces our commitment to the common good. It asserts that we are engaging with the complexity of our time, not from the periphery, but from the center of action. And in closing, I'd like to express my deep gratitude to the Lancet Countdown, their leadership for entrusting us with this responsibility, and we don't take it lightly. To our continental partners for their collaboration, and to the teams at Future Africa and also beyond within the University of Pretoria, and there's a lot of representatives from other faculties and institutes here from the University of Pretoria who have to work tirelessly to make this possible. I wish to express my appreciation to Professor Markotter for the enormous contribution she has made to host the center here at Future Africa, to Professor Tafadzwanashe Mabhaudhi for his leadership as director, to Dr. Liz Marie Besson for her stewardship as program manager, and to many scholars, partners, and institutions within South Africa and across the continent, we have made this a reality. May the Lancet Countdown Africa Regional Center significantly strengthens Africa's agency in shaping its climate, health, and prosperity future, and may it help that this generation and the next experience a wiser, a healthier, a more equitable, just, and a resilient continent and the world. I think we owe them. Thank you.
Thank you, Prof Petersen, for those really wonderful remarks. So we're going to move on to our next speakers, and some of our speakers, unfortunately, are going to be online. We hope at some point we're going to all be in the same room, but for today, some of them are unfortunately not with us in person. And the first speaker that's also going to give remarks is Dr. Marina Romanello, who is the Executive Director of the Lancet Countdown. I just want to check that, Dr. Marina, you can hear us?
Hello, yes, I can hear you, Wanda. Can you hear me?
Okay, perfect. I'm just going to introduce you and then I'll let you continue. So as I said, she's the Executive Director of the Lancet Countdown, specifically on tracking progress on health and climate change. She's also Associate Professor at University College of London, and the Lancet Countdown is an independent and multidisciplinary research collaboration between almost 100 academic centres around the world and headquartered at the University College London Institute for Global Health. Please go and look at the website for the Lancet Countdown to really get an idea of all these connections that you're hearing about today. I think you've got a little card also that has been given to you. Marina trained as a clinical biochemist in the University of Buenos Aires, Argentina, and holds a PhD in biomedical science from the University of Cambridge. Her research background spans from toxicology through to environmental health and climate change. And before joining the Lancet Countdown, she carried out her research in the Instituto Tecnológico de Buenos Aires, the University of Cambridge, and the Francis Crick Institute in London in the UK. So welcome, there you are. Now I can at least see your face. Welcome, Dr. Marina, and I hope we can soon host you in person also at Future Africa. Looking forward to your words.
Thank you so much, Professor, and thank you all of you for joining the launch event. We're so delighted to have this event happening, to have the center being formally launched at Future Africa in Pretoria University. And thank you so much for the kind words towards the Lancet Countdown and the commitment of Future Africa towards hosting the Lancet Countdown initiative. Hosting a regional center is a huge responsibility, as you've just heard, but I hope you will also agree that is a good opportunity and hopefully an honor to be part of a bigger collaboration. And we couldn't be happier to have you on board leading this effort for Africa. I'm going to share a few slides. What I thought I'd do, because you've heard a lot about the importance of the African continent at the epicenter of climate change and health. Not only because it's already been dealing with the impacts of climate change and is at the forefront of adaptation efforts, but also because of the huge injustice of being so hit by a crisis that is not largely of its making. We have been very aware of the scarcity of engagement that we've had over the past years in the African continent. And launching this regional center is for us an absolute honor in terms of being able to engage with researchers in Africa who we have engaged with in other fronts, and we know there's a fantastic workforce there. So I'm going to share with you a bit of the Lancet Countdown itself, who we are, how we came to be, and what it is that we're trying to achieve and that we're now going to work on together. So the Lancet Countdown actually starts basically in 2015 when the Paris Agreement got signed. You might know that the Paris Agreement is the United Nations Framework Convention on Climate Change Agreement on climate change. It has a goal of tackling greenhouse gas emissions, keeping global mean heating to below 2 degrees above pre-industrial times, of adapting and supporting countries in adaptation to climate change, and addressing the threat of climate change to enable a livable, thriving future. And when the Paris Agreement got signed, although it was under the remit of the UN climate negotiations, it was hailed by the World Health Organization as potentially the most important public health treaty of the century. And this is because we have plenty of evidence that the actions that we need to take to tackle climate change go hand in hand with the most sensible, the most called for public health interventions, and that the transformation required and mandated by the Paris Agreement could actually lead the way towards a healthy future, towards that healthier health systems, more resilient health systems that we've been calling for decades. So the Lancet Countdown actually starts after the commission that was published at the end of 2015, formally 2016, which says that tackling climate change could be the greatest global health opportunity of the 21st century. And off the back of the Paris Agreement, it reached the conclusion that we have a huge opportunity provided by this internationally, legally mandated agreement to deliver those climate commitments in a way that puts health and well-being at the center of climate action. And that in doing so, we could really transform our public health, our health systems for the better. But it also concluded that in order to do so, we needed to provide decision makers with tools, with evidence, with data that showcases the health opportunities of climate action and that monitored progress towards delivering the Paris Agreement commitments in a way that would expose whether or not those health opportunities are being delivered, to keep policymakers accountable to expose the opportunities. And that is how the Lancet Countdown is born. It's born off the back of that commission from the Lancet, launched formally in 2016. So this is our 10-year anniversary. And it's born with the purpose of delivering that rigorous scientific monitoring system that would help us track progress as we deliver these climate commitments and we enable a healthier future. Today, the Lancet Countdown brings together over 130 contributing organizations from all around the world. I hope that in the very near future, we'll have this slide filled with African contributing organizations as well. And over the past 9 years, with this being our 10th year that we're currently preparing, we've been publishing these reports that you see on screen in the medical journal, The Lancet. These reports come ahead of each year's COP climate negotiations and provide iterative updates of almost 60 indicators on the links between health and climate change, exposing that evolving health risks, but also the extent to which our actions are or not protecting people's health. And as I said, we're now preparing our 10th report. In 2026, we'll launch our 10-year anniversary report, and we're so delighted that we will have the African Center represented in that report as well. But as you can imagine, these reports are global, and global reports often mean global data being put front and center, delivered through global data sets, and benchmarked by the data that is available globally. We very soon realized as we were launching these reports that policymakers often rely much more on regional or local data than they do on global data. And it also became very, very clear that we needed to have more focus on enabling local researchers across different regions of the world in being able to produce and improve on these indicators that we were producing globally, leaning on research capacity and the knowledge available at the local level. And that is how, kind of since 2019, we've been in this mission of opening regional centers. Regional centers, with the latest addition being, of course, the Africa Regional Center of the Lancet Countdown, which largely reproduce the model of the global Lancet Countdown at a regional level. And here, everything I've heard about the commitment of Future Africa towards transformative, transdisciplinary research is music to my ears, because that is what the Lancet Countdown is about. It is about bringing a really transdisciplinary team of researchers from every aspect of the intersections between climate change and health to think about innovative, transformative solutions, to put together data that can truly inform action to protect people's health. And that everything that we do is underpinned by the notion that we're in a crisis and we need to deliver solutions and data to inform action that protects people's health. So these regional centers have been growing over the past years and are now producing the regional reports. I'm so glad that today we can say every center has already published an academic report. And we also have an academic report that was launched through the inception of the African Center, with much of its current contributors also represented in that report. These regional centers mirror the structure of our global report, producing annually or biannually these indicator reports that you see on screen. And as I said, the Lancet Countdown is all about transdisciplinary research, exposing the connections between climate change and health, but also how every aspect of our efforts to tackle climate change will ultimately affect people's health. So we're divided into 5 working groups. The first working group looks at the evolving risks, hazards, and impacts of climate change on health. And that is kind of our health impact tracking. The rest of the working groups largely monitor progress towards delivering progress on climate change and health. The second working group looks at efforts towards adapting our health systems and broader health determining systems towards delivering a healthier future. The third working group monitors mitigation efforts to reduce greenhouse gas emissions, and how those actions are affecting health through the direct benefits that they have in terms, for example, of the associated reduction of air pollution that comes with fossil fuel phase down, or the healthier diets that come with more sustainable food systems. Our fourth working group brings together the economic perspective, monitoring both the economic impacts of the health impacts of climate change, quantifying those economic costs and those losses and damages, as well as monitoring the extent to which we're transforming our economic and financial systems to enable a healthier, thriving future, that economic and financial transformation that underpins the economic determinants of health. And last but absolutely not least, our fifth working group looks at the public and political context, the extent to which our policymakers are understanding that when we talk about climate change, we're fundamentally talking about potentially the most important public health threat of the century, that our scientists are now looking at the intersection of health and climate change, how climate change and health is portrayed in the media, and how we're communicating the risks and the opportunities to the general public. These 5 thematic working groups therefore cut across virtually every area of expertise and are mirrored, as I said before, across our different regional centers. And I'm just so delighted to share that the Lancet Countdown Africa Center has now finalized the period of recruitment of our working group leads for Africa. I know that some of you are now in the event, and that was an open advertisement that was quite competitive. We got outstanding applications from across the African continent, and I'm so glad about the level of researchers that engage with the call and that now are leading our academic working groups. But obviously, while academic research and scientific indicators are at the center of what the Lancet Countdown does, that is just the beginning of the story. We are not about just publishing outstanding papers in high-impact journals. We're about ensuring that the evidence and the science that we generate is available and is actionable to drive change and to deliver policies that protect people's health from climate change. So at the core of what we do is efforts to turn research into impact. As you can see there on screen, the Lancet Countdown has roughly 3 core arms, one of which is that research and monitoring academic capacity. But importantly, we also have a strong effort towards policy engagement and translation of our scientific evidence towards policy products and towards making them accessible to decision makers. And obviously our communications and outreach. We strongly believe that it's our responsibility as researchers in the midst of this crisis to communicate science accurately and rigorously to the general population, to our fellow researchers, to the scientific and general public. And therefore, we also put a lot of efforts towards communications and outreach of our work. And we also put a lot of focus, as you've heard, in capacity building, in ensuring that we're training an up-and-coming, very strong cohort of researchers and research fellows within the Lancet Countdown, and that we're engaging the broader scientific community in being able to develop these rigorous indicators, models, and monitoring systems on climate change and health, so that we can truly deliver that bottom-up, locally led effort to track progress on health and climate change at the highest level of rigor. And with that, I wanted to thank you so much for your time. I know you're going to hear a lot about what the Lancet Countdown has planned already to deliver through the Africa Center. And I did not want to leave without thanking once again Pretoria University, Future Africa, and above all, Tafadzwanashe, our fearless leader who has stepped out and also got this position through a very competitive open process and obviously got appointed due to his outstanding track record on climate change and on health efforts. So I'll leave you now to the rest of the event, and I hope truly that next time I will be able to visit. If it's not for an event, I will soon find an excuse to be there with you in South Africa. And once again, thank you so much for your efforts, for your partnership, for your collaboration, and for everything that you have done to ensure that we can launch the Lancet Countdown Africa Center at Pretoria University, Future Africa today.
Thank you so much, Dr. Romanello, and we're really looking forward to see you at some point, and thank you for those remarks and also the support from the Global Lancet Countdown. So we're going to move to our next speaker, and this is somebody in person. It's always really great to have the National Research Foundation of South Africa in the house and have them here in person. So I'm going to introduce Dr. Nana Boaduo, who is currently the director of the South African Research Chair Initiative. You will know them as the SARCHI chairs at the National Research Foundation of South Africa. He's a conscientious natural scientist and professional person with extensive training in biological sciences. He possessed both theoretical and practical experience in both teaching as well as training with thorough and precise approach to personal and assigned projects. He has worked with various international funding agencies, the British Academy, British Council, Swiss Tropical and Public Health Institute, German Aerospace Centre on various funding initiatives. Nana joined the National Research Foundation in 2014. It's already more than 10 years that you've been there. As a professional officer in the Strategic Investment, Innovation and Impact Department, previously the Research Chairs and Centres of Excellence Directorate. He was responsible for managing these Centres of Excellence and also the aligned centres that goes with it. Before joining the NRF, he was a senior technical officer and lecturer at the former University of Limpopo Medunsa campus, now Sefako Mogato Health Science University, also in the biological department. He's a member of several professional bodies. He obtained his BSc degree from the University of Witwatersrand, his honours degree, cum laude, from the University of Limpopo, formerly the Medunsa campus, and then he started making the right choices. He's one of our alumni who did his master's degree, also with distinction, at the University of Pretoria in paraclinical science, and his PhD was conferred in 2014, also at this university. So welcome, Nana. We're really glad to have you here.
Thank you, colleagues, and thank you very much for that lovely introduction. My message is it's going to be very short, not too long. As Wanda already said, I am from the NRF, and she asked me to just share a bit of a message of support on behalf of the NRF. So just to sort of stand on the protocol that VC has already said, I'm not sure exactly who is in the room, but just to observe all protocols and just to say, ladies and gentlemen, distinguished delegates, colleagues and partners, it is a privilege to deliver this message on behalf of the National Research Foundation. We extend our deep appreciation and support for the Lancet Countdown Africa Regional Center on health and climate change. As you all know, across our continent, we are witnessing firsthand how climate change is reshaping daily life through rising temperatures, extreme weather events, shifting disease burdens, food insecurity, and the growing strain on our health systems. These are not distinct possibilities. They are realities that demand clear, decisive action and strong and meaningful collaborations across all partnerships. This is why the work of the Lancet Countdown Africa Regional Center is so important. The center stands at the forefront of generating rigorous Africa-led scientific evidence to guide policymaking and inform public health responses, and also bring together experts from across disciplines, across their countries and across sectors to ensure that the continent's voice is not only heard, but it also becomes essential in the recognition of the climate health discourse. Now, within, obviously, as the NRF, we applaud the center's commitment to strengthening research capacity, promoting innovation, and supporting government with the tools they need to protect communities. We share this commitment. The challenges before us are too great and too urgent for any one of us to face alone, and that partnerships such as these are critical in building resilient, healthy, and sustained future for Africa. As South Africa's premier research supporting agency, the NRF is dedicated to working alongside the regional and international partners to strengthen knowledge production, promote innovation, and support initiatives that drive transformative change within the system. We regard the Lancet Countdown Africa Regional Center as an invaluable ally in this mission of ours, and we recognize that addressing the intersection of climate and health requires long-term vision, sustained investment, and collaborative and sort of collective resolve. The National Research Foundation stands ready to collaborate with the partners in the room and the partners that you have across Africa and beyond to strengthen the scientific capacity, cultivate innovation, and support evidence-based policy interventions. We are proud to stand alongside the Lancet Africa Regional Center as it continues to illuminate the links between climate and health, to advocate for evidence-based solutions, and to empower Africa's policymakers and researchers within the knowledge system that is needed to drive meaningful change. So on behalf of the NRF, I do extend our support and deep appreciation for the work of the center, and we look forward to continued collaboration going into the future. And thank you so much for the opportunity to share these few words. Thank you.
So not so quick, Nana, because you're an external guest. There's a present. Sorry, DC, we don't give you more presents. So thank you for those words, and thank you for the support from the NRF. So the next two speakers, we're going to go online again with really important Africa collaborators and stakeholders. And the first one is Professor Brama Koné, who is the Technical Officer for Climate Change and Health at the World Health Organization Africa Regional Office, where he brings over 20 years of experience across WASH, public health, and climate change adaptation. There you are. I'm just making sure you can hear us, Dr. Koné.
Yeah, sure. I can
Okay,
hear you.
perfect. I'm just going to continue a bit with your resume, and then I'll hand over to you. And I think you also saw when you look at Marina's slides that the WHO have a very strong stand on climate and health, and I'm sure Dr. Koné will also refer to that. He holds advanced qualifications in sanitary engineering, epidemiology, and environmental epidemiology, and has taught and conducted research across multiple West and Central Africa countries. He has held senior academic and research leadership roles, including at the Swiss Center for Scientific Research at the Côte d'Ivoire and the Ministry of Higher Education and Scientific Research. His work focuses on climate-related health risk, disaster risk reduction, and the epidemiology of waterborne and vector-borne diseases, supported by very strong technical skills in policy advisory, program management, and environment and health impact assessment. Thank you for joining us online, Dr. Koné, today. And we look forward to also having you in person at Future Africa sometime in the future. You can go ahead. Thank you.
Thank you so much, Excellencies, distinguished colleagues, dear friends from the media. I hope some are there in the room. Ladies and gentlemen, it's a great honor to join you today for the launch of the Lancet Countdown Africa Regional Center. This center represents a historic milestone for our continent, a commitment to place evidence building on climate and health at the center of climate action. Climate change is already reshaping Africa's health landscape. Between 2001 and 2021, more than half of all public health emergencies on our continent were climate-related. Last year only, we recorded more than 300,000 cases of cholera and more than 7,000 deaths, all belonging to poor sanitation, lack of water access, and population displacement that are all exacerbated by climate change. As already said, while Africa is among the most vulnerable and affected regions of the world, it's unfortunately, and luckily, I would say, it contributes the least to global emissions. This paradox underscores the urgency of building climate-resilient health systems for our continent. The WHO African region has responded with a framework for building climate-resilient and sustainable health systems lasting for 2024 to 2033. Its vision is clear. All Africans enjoy quality health services delivered through climate-resilient and sustainable health systems. At the same time, our new regional director has articulated a manifesto for transformation that calls for resilience, sovereignty, and universal health coverage. Climate resilience is not optional, it's fundamental. We cannot achieve universal health coverage if our systems collapse under climate stress. The Lancet Countdown Africa Center will be then a critical partner for us in this journey. By tracking climate-related health indicators, generating locally relevant evidence, and strengthening regional research capacity, it will empower policymakers with the knowledge they need to act. Through the REACH initiative, Research for Action on Climate and Health, implemented by WHO, this is an initiative aiming to shape climate and health research agenda in the world, including in Africa. We are building on expressive need of policymakers, communities, and practitioners, a relevant climate change and health research agenda for our region. Together with REACH and other existing initiatives, the Lancet Countdown Africa Center will ensure that Africa priorities for climate and health research and evidence are targeted and effectively documented. We, as WHO Africa Regional Office, our role is clear. We will continue providing technical leadership when it comes to assess vulnerability and adaptation, when it comes to draft health national adaptation plan, when it comes to draft decarbonization roadmap. We will continue advocating for health in international negotiations, including UNF3 policy negotiations, in national climate strategies. We will continue convening partners across government, academia, civil society, and donors around climate change and health issues. And we will continue supporting the translation of evidence into policy and practice. Our partnerships matter. With welcome trust, the Lancet Countdown Africa Center, African universities, Ministry of Health, and civil society, we are building a coalition that will transform vulnerability into resilience and climate change mitigation into opportunities to increase resilience. Lessons are already emerging. Countries that integrate health into climate commitment mobilize more resources. Communities that participate in adaptation planning ensure equity and sustainability. And when Africa speaks with more voice, health gains visibility and influence. We must also recognize unique opportunity of Africa. The continent holds the vast reserve of mineral essentials for clean energy technologies. If managed responsibly, these resources can fuel a just low-carbon transition that protects health and livelihood. But if exploited through harmful practice, there is deepening inequities, damaging local environment, and increasing local climate risk. Yes, I hear time is over, and I will finish soon. The Lancet Countdown African Center must help us track these dynamics and ensure that health remains a guiding principle in Africa's industrial and energy transition. Looking ahead, and to end by this, we will continue scale up. We need to continue scale up evidence generation, support member states to implement climate resilient health intervention, mobilize innovative financing, ensure that Africa abundance resource fuel just low carbon transition, and importantly, ensure that every African benefit from health system prepared to present and future climate challenge. Colleagues, for us, this launch is more than an event, it's a commitment. A commitment to build a healthier, more resilient Africa together. Let us seize this opportunity to align science, policy, and action. Because climate change is the greatest health threat of our century, and because Africa, as one of the most affected, must lead in shaping the solution. With gratitude, I thank you for your kind attention. Thank you.
Thank you, Dr. Koné, and I know we work with WHO and AFRO quite a bit across the university, and we're looking forward at strengthening that partnership also through this center, and hope that you will visit us at some point also in Pretoria. So the next speaker is also online. I just want to check if he is there.
I'm here and I
Professor.
can hear you.
Okay, and you can hear us. So Dr. Githinji Gitahi, and I hope I pronounced that right, is from Amref Health Africa, which he joined in 2015 and has held various roles across health, media, and private sector. Prior to joining Amref, he served as Vice President and Regional Director for Africa at Smile Train International. He is a renowned leader on both global and regional fronts with notable achievements, including co-chairing the global UHC 2030 movement and serving on the Commission of Africa's COVID-19 response. He previously also served on the governing board of Africa CDC and the board of the National Cancer Institute. Additionally, he is the co-chair of the Strategic Advocacy Committee for PMNCH and serves on the board of the Coalition for Epidemic Preparedness and Innovation that we know as CEPI, the board of trustees of the Safaricom Foundation, the Scaling Up Nutrition or Sun Movement Lead Group, and the board of Food for Education. He also serves at the independent board of the Lancet Countdown, which I think is also important in this context. He is a vocal advocate for pro-poor universal health coverage and leads the largest thought leadership convening on the African health agenda. We're looking forward to your words. Thank you, Doctor.
Oh, thank you. Thank you very much. And I'll not take long. I'll try to be very, very brief. And I am calling in from Kenya. And last week we had severe weather events. We had severe flooding and about 69 people died in Nairobi. Of course, this has a relationship with the global warming, the climate change issue that we're discussing now. I think for me, I will speak both as a board member, but also as a member of the Amref Health Africa group that works on development across the continent. And what we see is that whereas the discussions around carbon trading, carbon emissions, and all these things are really critical and important, we see communities in the front line of all these difficult terminologies. We see them, the flooding, as I talked about, happening more frequently. We see drought, as we talked about earlier. We are seeing increasing disease outbreaks emerging and re-emerging. We are seeing major impacts on many sectors, water, sanitation, education, and all these things. But for the communities that are being impacted, they actually don't know what we are talking about today. They don't know the Lancet Countdown. All they know is that their lives are becoming more and more difficult. And because of that, they are wondering what next. And what the governments are doing is that the governments are then saying, we have a climate change agenda in our ministry. The president is attending a conference somewhere at the Conference of Parties and all these things. And at the end of that conversation, then the governments come back and say, we will deal with this issue. And they make significant commitments in the nationally determined contributions of their countries to say this is our climate strategy. But when we look at those climate strategies, we don't see much of health, whereas we think that health is actually the human face of the climate crisis. It doesn't matter how many carbon emissions and carbon metric tons and greenhouse gases we count. At the end of the day, it is all reflected in the impact on human life in many different ways, as have been discussed by others here. But when the governments then go and do commitments on the nationally determined contributions, then we say, are these nationally determined contributions aligned to the will of the people? Are they human-centered? Are they actually addressing the challenge of the African people? Because these nationally determined contributions are countries in Africa that are preparing their strategies on climate change. And we find that actually, no. We find that most of these, close to 70%, actually have to do with mitigation. And whereas mitigation is really important and critical in this conversation, must not be health washed, must not be wished away, we find that most of those commitments that are financial commitments, either national or development assistance, about 70% of them will relate to mitigation efforts. And a lot of this will be on transport and energy decarbonization. In many other countries where this is their focus, they don't even have survival level energy. You look at Central African Republic, you look at Chad, look at DR Congo, their metric tons emissions are below survival level energy. And therefore, when they concentrate significantly on just mitigation, whereas mitigation has health core benefits, and we must also have data on that. They focus extremely on what they see other countries doing, because even when they focus on this, it's not that there is a national study that says that actually our best investment for our money is in mitigation and decarbonization of the transport and energy sector. That evidence is lacking, and therefore they're using evidence from elsewhere to determine their national determined contributions. And therefore, out of these national determined contributions, you find that governments are committing 2.6 trillion or $2.5 trillion that need to be spent by 2030 to ensure they achieve their commitments on the NDCs. And in those, health is only about 2% of that total 2.5 billion. Of course, there's a big gap of financing. This is just futuristic, dreamy numbers, because we have seen that countries that need to contribute to this NDCs are not contributing. So, but the target number, significantly 2.5 trillion, and only 2% of that is on health. So the question then we ask ourselves is why? Whenever we go to advocacy meeting, we go to the conference of parties and elsewhere, well, the data available is from elsewhere. It's not available in Africa. We don't know, we haven't done enough data to inform not only the IPCC, the IPCC on the data that informs the COP on its strategy. All the data available is elsewhere. So I think the launch, therefore, of the Lancet Countdown Center in Africa is critical in providing data for evidence, and not only for COP and IPCC, for governments in Africa. And I would wish that, and congratulations Tafadzwa for picking up this big weight on your shoulders, and we'll be coming and knocking on your door. And I hope you have broad enough shoulders, because we are going to really be on your door, is that not only should we look at informing the international community, informing the IPCC, informing the conference of parties, but how do we inform African governments so that they make evidence-based policies for their countries fast, ensuring that climate change commitment that they have made are also embedded in their local policy. And I think that is what will be really, really critical. For us at Amref, we see the impact happening every day, and we have tended to develop strategies that involve communities, indigenous knowledge of what's happening, both qualitative and quantitative. And more recently, we launched a Wellcome Trust and UK government-supported center, Pan-African Center on climate change at Amref International University, which will be collaborating closely, and we'll be working closely with the center, in addition to other communities we are doing country by country that have to do with kind of holistic data, One Health data, including communities bringing their data as well, so that we can inform government policies. So I'm looking forward to, as a board member of Lancet Commission, but also as a public health enthusiast, as somebody who is interested in successful primary healthcare in the continent, I'll be looking forward to see how we can develop data that informs evidence to protect the primary healthcare system against the danger of the rising climate change derived global warming and the impact that having on communities at an injury level, but also infectious disease level, and also NCDs, because of all the other issues that are impacting nutrition. So thank you very much, and very proud that we can celebrate that the Lancet Countdown has an African Center. This is a major step forward. And thank you, Marina. Congratulations, Tafadzwa, and congratulations to everyone, including the University of Pretoria. Back to you. Thank you.
Thank you, Doctor, for those insightful words. And I think my VC will remember the word human-centered, because that's an anchor in our new Thrive 2038 UP plan. And we really also mindful of that is the way that we need to think about solutions and impact. So now for the, I think what will we call you, Tafadzwa, the star of the day, or maybe the one with the most resilience to still be here after months of trying to get this off the ground. We really, it's an honor to introduce Tafadzwa, who is probably going to tell you more of what this is actually about and what we're going to do. He is Professor of Climate Change, Food Systems and Health at the London School of Hygiene and Tropical Medicine, which is in the UK. And then you've heard a lot today about him being the director of the Lancet Countdown Africa Centre that we're here to celebrate and launch today. He will always say, you said it the other night also, that you like to apply a systems approach at the intersection of water, energy, food, environment and health systems. Really important to look at this nexus and not look at it in isolation. And also it's known as the WEF plus nexus. He's leading research, teaching, and policy-relevant work to strengthen sustainable climate-resilient food systems. In addition to his role at the LSHTM, Tafadzwa is also the lead for the Water, Energy, and Food Environment Nexus for the United Nations University that I spoke about earlier, the UNU Reach Hub that we also launched last year. And he's also director of the Institute of Natural Resources. We're lucky to have him as an extraordinary professor also at University of Pretoria, and I have to softly say University of KwaZulu-Natal also, but it's a privilege to hear you speak. And from my side as Interim Director of Future Africa, thank you for hanging in there, and thank you for bringing these initiatives to University of Pretoria.
Well, thank you very much, Wanda. Good afternoon, the Vice-Chancellor, Deputy Vice-Chancellor, and members of the Diplomatic Corps, and all protocol observed. I hope I got that right. I'm not a very formal person. I'm more of a scientist than anything else, so forgive me if I get the protocol incorrect. But I'm happy to be here today in person. Last year in July, we launched another huge initiative, the United Nations University Hub on Rich Africa, which I also lead. Unfortunately, I could not be there in person on that day, so I was one of the people on the big screen. So it's really fantastic to be here today in this room and seeing everyone. I think I was tasked with giving some key pointers about the countdown, and my program manager, Liz Marie, did a fantastic job of giving me some talking points. Unfortunately, I lost the email, but I do know, Liz, you gave me some talking points. Thank you very much, but I lost them somewhere along the way. And then I was trying to come up with stuff to say, as you know, people were talking. I'm not really good at preparing speeches and that kind of thing. It's not really my forte. Scientific publications, more my forte than speeches and stuff. But it's always nice to come at the end when everyone is spoken, because then they've said everything. And I really don't need to be the guy who repeats the points that have been made. So we had the Vice-Chancellor kickstart and tell us the strategic importance of the Countdown Africa Center, especially in terms of what does it mean for Africa? What does it mean to have Africa led for Africa by Africa? Like, what does it mean? And often we just say Africa led by Africa for Africa because it's a nice mantra, but we don't get into what it means. And a couple of years ago, I was still doing my PhD, graduated in 2013, and around 2015, of course, the Paris Agreement came in. 2016, the report that Marina was mentioning was published. And I remember reading that report and going, wow, like, where do people do this sort of science? Like, where does it happen? How does it happen? And I remember following the reports thereafter and just being so impressed. And you know, you read Lancet Countdown, you can't even picture a building that is written Lancet Countdown. You can't picture a face, but you're enjoying the science, you're enjoying the information and the evidence, but you can't relate to it. as an African. You don't know anyone who is involved there. When you read the authorship, there's no one that you know. And in some instances, there's no one who looks like you, when you see pictures of it. And so when we say for Africa, we're trying to say there must be a picture that when people say Lancet Countdown Africa, what do they see? They'll picture future Africa at the University of Pretoria, being that place where the Lancet Countdown is. They'll be able to relate to it. They'll see some faces that look like them, that talk like them. They'll see some names on the report that are spelled like their names, that no one can pronounce quite easily, like my last name and my first name. And they'll be like, there's somebody with a complicated name over there. But it makes it all very relatable. And sometimes the ability to relate to things has a lot to do with our ability to trust information. Because sometimes if we can't relate, it's very difficult for us to trust. And we talk a lot about wanting to make impact on policy and action. But if I don't trust you, if I can't relate with you, what assurance do you have that I'm going to take what you say and actually run with it? Because I can't relate. And a lot of time as scientists, we are preoccupied with the rigor and robustness of our science, the methods, but not the relatability of the work, not the relationship, not the face, not the understanding, not the context. And what the Africa Center will do, most importantly, that is not written anywhere in the documents, is it will establish a face, it will establish a relationship, it will provide context, it will build trust and a relationship that will transcend the robustness and rigor that we love to talk about, and build a relationship of trust and relevance that will allow people to start utilizing that information. It will create a relationship that will allow us for the first time to hear what policymakers are saying. You heard Brama talking there. You heard Githinji talking there very passionately about climate change and health and why it is an urgent matter, why it needs to be addressed. For the first time, their voices, their passion, their interests is going to be taken up directly and translated into a document that we shall publish, that shall speak back to them and empower them to take the sort of decisions that they need to make. And that's not just about policymakers. Just now, as I was sitting there and everyone was talking big things, I was writing down all the big things and thinking of topics for my postgraduate students, thinking this sounds like a nice research question, fantastic, someone is going to do this. So again, it means our postgraduates that we train are going to be trained at the interface, at the frontiers of science that is relevant and that is actually needed. And it makes a big difference. They will be trained in transdisciplinary spaces that are not theoretical, but that are practical. They will get to participate in events and engagements that are critical, where they'll understand the importance of information. How does science get translated to informing big decisions and big ideas? What does that room look like? Who are the people who get to be in that room? What sort of questions do they ask in those rooms? And what carries the day? Often our students don't get into those spaces. Often our students don't even know that there is a room somewhere where people sit. And it makes a huge difference when they enter into the world and want to be researchers and scientists and engage on global issues, because they can't fully engage on global issues that they've never participated in. They don't know what is the global conversation that they need to be contributing to. So then they're always behind, and they are going to be like me when I was young, marveling at other people's work. Now we need to change that. They need to marvel at their own work. They need to be the authors of that fantastic science that we are all going to be utilizing. So this Countdown Africa is not just going to be here at UP writing a fantastic report every year, publishing it and so forth. It's actually going to mean something for everyone, and it's going to mean something for our young people in this room and those who could not be in this room. It's going to facilitate partnership, it's going to facilitate engagement, and it's going to facilitate capacity development and strengthening. Everyone has said that broad shoulders, challenge, I'm going to suffer, all of those things that ordinarily I should have left the room by now in panic to say, okay, no, that was not written anywhere in the advert when I applied. It did not say anything about suffering and broad shoulders and any of those things they are mentioning. But I took on this role mostly because of my passion for Africa and my passion for capacity development and my passion for participation and making it meaningful. I've been blessed to have the opportunity to participate in a lot of these engagements, sit in global platforms, participate in global things. But it's not a blessing enough if it's just myself sitting in those spaces. Of course, it feels very nice when they say he is the only one, but in that moment when they call you the only one, you should also pause and reflect and ask, but why? Where are the others? What is the pipeline that we are building for others to also fill these rooms and spaces? And part of why I wanted to bring the Lancet Countdown here, Wanda, and also the UNU Hub here, and it's just the first of several institutions that we need to give a home in Africa. It's because for us to participate, we must actually host. We can't just want to participate in things that we are not taking an ownership of, because then we are just crying to be in someone's house, and that doesn't make sense. So we need to build the house ourselves, and then we can occupy the house, and then we can invite others into that house. So what we are launching here today is not just a center that's going to be tracking climate change and health, but we want it to be a center that's going to represent all of Africa's shared ambitions, shared aspirations, shared hopes in terms of having our voice heard, knowing that our voice matters in this discourse, and being able to bring it to bear in important regional and global discussions, being able to inform our national researchers, being able to inform our national policymakers, and creating spaces for young people to grow, engage, and participate in. We hope that through the global partnership that the Lancet Countdown has, as Marina said, that there's 100 institutions plus with more than 300 experts, that it will allow us to leverage into those 100 institutions and those 300 experts and see them walk through the rooms of this auditorium so that they too can come and share with us what they know, and we too can learn and share with them what we know, and show that we do know certain things and many things, and for us to be able to really meaningfully participate in this global think tank and agenda. People said they'll knock on my door. I do not have a door. I have a very open space around me, so all you need to do is to walk in and walk through. There is no door. I have no protocol. Fortunately, I'm not anyone important, so I do not need to be addressed in any particular manner or way. As long as you show up, I'll be happy to engage with you. I work across 3 different continents, so chances are at any time you'll find me awake, because I'll usually be in a time zone somewhere where we can engage. So time is never really an issue. Any time is tea time where I'll be somewhere. So I'll be looking forward to engaging with everyone in this room and outside of this room, and to having your support as we build this center. I really thank the University of Pretoria's leadership that is sitting in front here. It was a key step because they wrote the letter. Marina mentioned that it's a globally competitive recruitment. So there are two things involved. There is the recruitment of the director, which is the globally competitive process. But then there is where the director will sit with the secretariat. Now that is on the basis of institutional affiliation. And as you heard, I'm with the London School, and University of Pretoria was quick enough to say, we will host you. We will move to appoint you as an extraordinary professor. We'll give you a home at Future Africa, and we'll give you a space to operate from. And the contract for the countdown was only signed last week. But in that whole time, we've been operating, we've been engaging, emails have been getting sent, and you've been hosting us the whole time, even before the contract was signed, since April last year when they announced it. So I would really want to extend my heartfelt appreciation for your leadership, starting from yourself, Wanda. You wrote the letter, Sunil co-signed the letter, and it made a huge difference in terms of demonstrating high-level commitment. We are here today, Vice-Chancellor, Prof Petersen is here, and it matters in the room when the leadership of a university shows up because it demonstrates high-level commitment. You spoke about the strategy. Again, it shows that what we are doing here is not just a parallel thing that does not fit. It shows that there is goodness of fit and relevance, and therefore it is something that will be institutionally supported. And we hope we can grow it into something that is not just of UP, but that is truly African in the sense of the name of the center. And there is no better host than Future Africa, aptly named Future Africa, where we want to be. And this center is basically at the intersection of that future in terms of guiding us, generating robust, relevant information, building capacities across individuals, institutions, communities, and policymakers to help guide that transformation of Africa as a whole towards a just, equitable, inclusive, and healthy African future that we can all be proud of. So with that, I bring my speech to an end. I hope I've covered Liz Marie's talking points. If I've not, forgive me, Liz Marie. I think there'll be another speech somewhere, someday. I promise to stick to the script in that order, but I'm just happy to be here today and to see this Africa Center launched. Thank you very much.
After all the formalities, you will at least have a chance to have a glass of wine with Tafadzwa and celebrate this. So maybe just one thing I wanted to add, I don't know if that was in your memo list, but this is the launch, so high-level talk. There's going to be a workshop at some point that Tafadzwa will send to everybody, and that's where the real work's going to start, shaping the activities and where we're going to go with this. So please look out for those emails and those invitations. But like he said, his door is open. Speak to him if you've got ideas. There's lots of young minds that I'm seeing in the audience that I'm sure can shape this better than some of these old researchers, including me, that's here. So Prof Sunil, I'm going to read your bio, and there's a very good reason why I'm going to read it, because I don't think I introduced the DVC ever. He's always at the end and then he says thank you or something, and then we go. But Prof Sunil Maharaj has served as a Vice Principal for Research, Innovation and Postgraduate Education at the University of Pretoria since August in 2022. Prior to this, he was also the Dean of the Faculty of Engineering, Built Environment and Information Technology from 2014 till 2022. So 2 of our leaders are actually engineers. I don't know if that's a good or a bad thing. We'll see in a few years. He is a distinguished fellow, he's a professional engineer with the Engineering Council of South Africa and a distinguished fellow of several prestigious institutions, including the South African Academy of Engineering. In 2021, he was elected chair of the Global Engineering Deans Council, becoming the first African to hold this position. Prof Maharaj's research expertise lies in 5G cognitive radio sensor networks, OFDM MIMO systems, I'm hoping I've got that right, and edge computing. I don't know if any of you knew this was his research expertise, but that's why I wanted to read it. His significant contributions to rural broadband and 5th generation communication technologies earned him the distinction of being the first African to receive an honorary doctorate of philosophy from Malmö University in Sweden. This honor recognizes groundbreaking work on reliable communication technologies for undeserved remote regions in sub-Saharan Africa. So the reason I wanted to read it, because now we at least know what our DVC's research expertise is, and we're looking forward to the closing remarks. Thank you, Prof.
Good afternoon, colleagues. Since I'm between you and the cocktails, I'll try and keep it short. Again, as they say, all protocols observed. Our Vice Chancellor, our dignitaries, our keynote speakers, our people from the Diplomatic Corps, welcome to all of you, and of course, our online guests. Thank you for being there, and thank you for joining us this afternoon. So my job is to close today's event, a historic moment in the history of, I think, Africa, not only for UP, but certainly Africa. And I think it's important for us to celebrate what we have come thus far in this particular journey going forward. I think the key feature of UP, as you know, the Vice Chancellor mentioned, we have UP or Thrive UP 2038, our new strategic plan. I think it most strongly foregrounds the imperative of societal impact under the hallmark of academic excellence. I think in particular we view ourselves as an African university, of course deeply committed to contributing to scholarship and solving societal problems in Africa, and in doing so we will achieve global impact. So if you look at a new vision statement, it clearly emphasizes an impact-driven, research-intensive university. So it's all about impact going forward, and something we're planning going forward. I think as you heard this afternoon, Professor Markotter, our Future Africa Interim Director, talked about this transdisciplinary collaborative platform, a convening space specifically to use and unlock the transformative potential of African sciences to inform and inspire a future of thriving African societies, and a space to transform and, of course, help our African researchers to thrive. So it's, as you can see, Future Africa is uniquely placed. It doesn't belong to any particular faculty, it doesn't belong to any particular academic department, it doesn't belong to any particular professor as well. That's why it's called Future Africa Platform. And the reason for that is deliberate, so that we bring different people together. As we talk in Africa, the calabash being the melting pot of everybody's ideas, and that's what we try to create in this space, and we're hoping that it'll give the credence, as Tafadzwanashe mentioned, in going forward. I think therefore we have created this ecosystem, and we think that this is the most appropriate space for the Lancet Countdown African Regional Center. I think Professor Mabhaudhi unpacked how the center will function and give some kind of a roadmap for the engagements and the planned outputs that we expect going forward. I think we are confident that under the leadership of Professor Tafadzwanashe, we will see an ever-increasing policy and other impacts emanating from the center's activities. And of course, most important, galvanizing people, bringing people together from different areas, from energy, climate, health, our veterinary sciences, and our climate and sustainability folks, and our engineering folks, and others together. And that's the important, and that's going to be the differentiator in terms of charting the way for Africa. In particular, I think we look forward to seeing the growing use of Africa-specific data to support policy and action agendas. I think in order to achieve this, mobilizing African experts to take up opportunities to join the center working groups and contribute data has to be their priority. And we just launched last year our high performance cluster at University of Pretoria. And for data, you need computing power, and I think we have that. And of course, South Africa also has the high performance cluster. So as a collaborative initiative, I think we have the infrastructure to support that moving forward for the African continent. I think in his address, Professor Petersen also spoke about the strategic importance of hosting a center like this at the university. Indeed, the congruence between our strategic objectives as a university and those of the global Lancet Countdown and the regional center in particular is multi-layered, and it brings convergence and value to both of us. I believe that the center will provide both the established, highly regarded UP scholars and other scholars already working on these themes together, as well as the scores of emerging academics, the opportunity to help and address the critical and of course interconnected challenges posed by climate change for human health, well-being from an African perspective. And I think the exciting part is, as we heard, there's 100 such institutions, how we bring the 100 institutions together to work and to share this. And of course, something like 300 or more experts across the globe. I think that's going to be a trailblazer for us on the African continent. We are grateful for the participation of Dr. Romanello from the Global Lancet Countdown in today's program, and they're heartened by the fact that global and existing regional centers have capacity that can support this center, particularly in its early stages and while we're developing it. We also greatly appreciate contributions made by the speakers from the NRF and the World Health Organization, and thank you, Dr. Na, for your time here and supporting us, and of course the SAGI chairs we have at UP as well. You clearly underscored the relevance of the center of building African scientific capacity and leadership, as well as the importance of health-centered approach to climate change from a continental policy, norms, and of course, health systems perspective. The remarks by Professor Gitahi from Amref provided valuable insights into the experience of climate impacts by healthcare practitioners, an important reminder of the diversity of voices that should be heard and must be heard in developing health-centered climate change responses on the continent. I believe that today's launch sets the scene for great things to come. As the University of Pretoria, we want to assure Professor Tafadzwanashe, our guests participating here today, and our online guests, and also the wider community of stakeholders in the climate health nexus in Africa, that we are here to work together and to realize the aspirations and dreams of the African people. If we cannot do it, no one else can do it, in my view. And we need to leverage our existing networks, our expertise both on the continent and globally, and that we can work together to make this center a success. Thank you to the organizers for putting this event together, the logistics, the AV team, and so forth. It was great. And as you know, it was a bit of a conundrum because we only signed the contract last week. So we were concerned that, would we be able to launch this in time? But I think things worked out very well. In turn, we have great expectations that our hosting of this prestigious center will result in greater visibility for the university and for the climate health research, and it will further catalyze transdisciplinary synergies, and it will ultimately ensure that African expertise helps shape international climate health responses. And the reports we put out will be adopted by many other countries, both the developed and the developing. As such, the center will support resilient, equitable, and sustainable futures for Africa and the world. And I thank you very much for being here this afternoon, making time to be with us and to celebrate this great milestone. As I say, to move forward, we have to take one step, and the first step, and I think this is the first step moving forward. At this point in time, I'd like to ask our online guests, I'll tell them thank you very much for being here. We're going to close the online presence at this point in time because we're reaching very much the closure of today. And colleagues, before we leave, I think there's a request for us to do a group photo. So please join us outside to do group photo. And then after that, please join us for the cocktails and we can network and discuss some research ideas. As Prof Tafadzwanashe said, let's brainstorm a few ideas and with the people that are around here and how we can move this forward. Because remember, this is placed at UP, at Future Africa, but it is everybody's platform. So it's each one of us responsibility to make it succeed and to make it work for us and see how we can engage constructively and build it.